What are the H. pylori testing methods? Have you ever wondered how doctors test for Helicobacter pylori, the bacterium linked to ulcers and peptic ulcer disease? Understanding the testing methods can help you grasp how this condition is diagnosed and managed. There are both invasive and non-invasive methods to test for H. pylori, and the choice often depends on the patient's situation and the purpose of the test. Invasive testing methods requiring a procedure called endoscopy, where a small camera is inserted into the stomach to obtain tissue samples. One common invasive test is histology, where the biopsy tissue is examined under a microscope to identify H. pylori. Another method is the rapid urease test, which detects an enzyme produced by H. pylori in the biopsy samples, giving quick results. Culture is another invasive approach where H. pylori is grown from the biopsy samples, allowing for confirmation of infection and testing for antibiotic sensitivity. Molecular methods, like polymerase chain reaction, can detect bacterial DNA in the biopsy tissue, which is useful for diagnosis and understanding antibiotic resistance. Invasive tests are typically reserved for patients with alarm symptoms, such as bleeding, weight loss, or anemia, or when there is a suspicion of gastric cancer. On the other hand, non-invasive testing methods do not requiring endoscopy and are often preferred for initial diagnosis, especially in younger patients without alarming symptoms. One of the most popular non-invasive tests is the urea breath test. In this test, the patient ingests urea labeled with a carbon isotope. If H. pylori is present, it breaks down the urea, releasing labeled carbon dioxide that can be detected in the breath. This method is known for its high accuracy. Another non-invasive option is the stool antigen test, which detects H. pylori proteins in stool samples. This test is useful for both diagnosis and confirming whether the infection has been eradicated after treatment. Serology, or blood tests, can detect antibodies against H. pylori, but they cannot distinguish between active and past infections, making them less useful for treatment decisions. There is also a stool polymerase chain reaction test that detects H. pylori DNA in stool and can identify antibiotic resistance genes, though it is less commonly available and more expensive. When selecting a test, factors such as availability, cost, patient age, and clinical presentation come into play. Non-invasive tests like the urea breath test and stool antigen test are often the first choice for diagnosis in patients without alarm symptoms. Invasive tests are typically reserved for patients who need endoscopy due to symptoms or risk factors. After treatment, confirming eradication usually involves non-invasive methods, like the urea breath test or stool antigen test, conducted at least for weeks after therapy. It is essential to choose the right test for accurate diagnosis and effective management of ulcers and peptic ulcer disease. Always consult with a healthcare professional for personalized medical advice regarding testing and treatment options.